So this headache is not stopping, it's banging. When you cough, you feel it. When you bend, you feel it. It wakes you up at night, it wakes you up in the morning. This headache, you're taking paracetamol, you're taking ibuprofen, it's not resolving. You're not known to have migraine headache. My friend, my brother, my sister, you must go to the A&E. You cannot wait for your GP. Go to the A&E because they need to do a scan for you. That headache is not a good. Still in the head, just sudden onset of confusion. You're now confused, especially in elderly people. You are now confused. You can't make out things. Things you know where you keep them, you can't keep them properly. You see your granddaughter, you're calling her a different name. You see your son, you're speaking different things. You are acutely confused. That is delirium. You must go to the A&E, especially in people who are taking blood thinning medication, which has a risk of bleed in the brain. You may actually be bleeding. You have to go to the A&E. That delirium actually also happens in elderly people when they're confused as well. It could be related to urinary tract infection, chest infection. That is acute onset of confusion and must be A&E for it to be treated, and that will stop in elderly people. Even space-occupying lesion, when they say tumor in the head, can cause headache. You know, there's a gentleman who can have headache for 3 weeks, and he thought it's something that will go, and then he comes to A&E, they scan his head, he has tumor in his head. I'm not saying that the headache you have today is that, but watch yourself. If you're having this long onset of headache, that has been ongoing for a very long time. Meningitis, or encephalitis, as the case may be, you have headache, you may have neck stiffness, fever, you have problem looking at the light, what they call photophobia. You need to go to the A&E. You've seen what I said about headache. Once you're having headache that is not resolving, with rest, paracetamol, ibuprofen, it's not resolving. You've eaten, you've drank water, you've rehydrated yourself. Do not wait for the GP. Go to the A&E. I've talked about meningitis. Seizure. First time you're having seizure in the head. We're talking about headache. First time you're not known epileptic, you just suddenly have seizure. You need to also quickly see the doctors so that they can refer you to the first seizure clinic for further investigation to find out if there's something else. It may even be tumor in the head that could be taken care of, or onset of epilepsy, and also giving advice on how to stop driving until full investigation is done. I'll go to the next slide. Okay, talking about the head as well, I'll talk about GCA. There's something they call giant cell arthritis. You're having this headache on the sides of your head, temporal headache. When you try to comb your hair, it's really painful. That's inflammation of the artery just beneath the scalp. It's usually it's a big problem. It can cause you sudden onset of blindness. So when you see that, you must go to the A&E. It's not to the GP. You must present to the A, because they need to start treatment immediately and refer you appropriately. It's called giant cell arthritis. Temporal arthritis, headache, very severe one, that could cause sudden blindness. To the next slide, please. I wish I have my control. Thank you so much. So we'll move to the eyes. So I have 2 pictures. I have one for just the eye, just to show that we're talking about the eye. And I have another picture on that side. That is what could be called orbital cellulitis, or septal cellulitis as well. Preseptal cellulitis, which commonly people may call orbital cellulitis, but it's preseptal. Orbital cellulitis is a very big problem with that kind of swelling. When you have encountered eye problem where your eye is swollen down around your eye, painful, you should not wait to see the GP, because I see where people say they're calling their GP for appointment, and it's not. This is a very big problem. Anything that's an infection that is on the face, around the head, is a problem, because it can quickly move by blood circulation to the brain, and then you get infection in your brain. So don't wait for your GP. This is a big problem that needs to be assessed by the A&E doctor. And if it is orbital cellulitis, you need to be referred immediately for admission, because that is deep inside the orbit of the eye. May quickly get into the brain. If it's preseptal cellulitis with that same presentation like this as it appears, then you probably can be treated and sent home. Do not joke with your eye. It's just 2. Once one goes, the other one. Okay, the next slide, please. Still on the eyes, yes. Now, glaucoma. Glaucoma is a problem. Many people have glaucoma and do not know because the pain may be gradual. But if you're having pain in the eye, maybe redness, headache, blood vision, you need to see the A&E doctors immediately, not to wait for your GP. Do not wait for your GP because glaucoma damages the optic nerve and that causes blindness. I have people who have gotten blind because of glaucoma, not recognizing the problem. If you're having eye pain, try and get checked because it could be chronic glaucoma that is there, just eating up your optic nerve gradually and then giving you loss of vision and you don't know what the problem is. If you're having eye pain, try and see your doctors so that they can refer you appropriately. Retinal detachment, sudden onset of loss of vision that did not cause you any pain. Just suddenly, you just lose vision and it didn't come back. You need to quickly go to the A&E because the retina has been detached from its attachment and they need to repair it immediately to see if there could be any remedy. Eye trauma, somebody hit the globe of your eye. That is a very big problem as well. Do not stay at home to use warm compress or cold compress to solve the problem. You need to go and see the doctor. Something hit the globe of your eye. It may cause permanent damage. Temporary loss of vision called amaurosis fugax. Sometimes 15 minutes loss of vision. You just stay, you can't see again. Wow. That is a sign of transient ischemic attack, mini stroke. You have to go to the A&E immediately so that they can start treating you and refer you to follow up for TIA clinic to ensure that you don't get stroke formally. That's amaurosis fugax, temporary loss of vision. It could be less than 24 hours in time. Just your vision comes back again. You have to see your A&E doctor, not your GP. Okay, I put retinal detachment 2 times. So I'm coming back to GCA, the one I talked in the head, because it concerns the eye as well. Headache and sudden loss of vision. It's giant cell arthritis. You need to go to A&E immediately, not to wait for your GP. That will be almost all about eye. Yes, and issues with eye redness, pain, watery discharge, or purulent discharge, you need to go to the A&E so that they can examine you, give you antibiotics, and if need be, also refer you immediately because it could be corneal ulcers, things that would give you more problem and give you loss of vision. So you need to see your A&E, and then they refer you to the specialist subsequently for review. To the next slide. Yeah, we're not in ear. Anything that gives anyone sudden hearing loss, difficulty in hearing, just suddenly you find it difficult to hear. One of the major reasons you have to go to the A&E is because, apart from the sudden nature of it, that, suddenly I can't hear again, you need to go there because it could be what they call sensorineural hearing loss, for which case they need to start treatment with steroid immediately to stop the inflammatory process that has distorted the nerve conduction. If you stay at home, nobody will examine you formally to know if it is conductive hearing loss or hearing loss from the brain. If it's conductive hearing loss from the examination, they may send you home and subsequently specialists will see you. It could be even sudden eardrum rupture, for which case they can examine and also see you and refer you, to be seen subsequently by the GP. Ear pain. You need to also go to the A&E. You don't need to wait for your GP because it could be more things, pus discharge from the ear, bloody ear discharge, objects in the ear, especially for children. You do not need to wait at home. You need to go to the GP. There's a bone behind the ear here. Infection around the ear can also spread to that bone called mastoid process. Mastoiditis becomes very swollen, very painful. It's usually a very painful situation for an individual. You cannot wait at home because this bone is also part of the skull bone. So easy spread inside the brain, encephalitis, meningitis, that will cause a very big problem. It needs to be urgently addressed and treated because there may even be pause for ENT surgeons to drain as well to take care of it. So you cannot wait at home to take GP antibiotics. You need to get to the A&E. To the next slide, please. Nose. So when people get trauma, they could rupture blood vessels around, and in between the division of the nose is like a septa. So blood can accumulate in between it, It's an emergency that needs to be addressed immediately. Where you find it difficult to even breathe, either one side of the nose or two sides of the nose, you need to go to the A&E, because the A&E doctor needs to refer you to the ENT so that they can remove that. Because if that is not taken care of, that would have helped you to drill a hole from one side of your nose to another. Where you don't want to intentionally open a ring hole. So preceptor hematoma is a problem. It may cause even respiratory obstruction. So you need to urgently see the A&E doctors. Epistaxis, bleeding in the nose that you've tried to hold your nose and lean forward and it's not stopping. It's massive. You cannot wait at home. You need to get to the A&E doctor so that they can refer you immediately to the ENT surgeons who will tell you to come immediately to come. No, nose, please. Remain on the nose. Nose, yeah. Nose. Good. All right, so post-discharge or post-accumulation that even obstructs your breathing. There could be, there are spaces around the nose called, some of them ethmoidal sinuses, that there could be collection of pus, fluid, things around it. It makes you not to talk well. You'll be talking with your nose. You can't breathe on one side of your nose. You need to come to air, in which case we have to do even a scan for you on the face to exactly locate where those collections are and refer you immediately, not home, to the ENT surgeons, because they need to do a drainage of the pus and treat you properly on antibiotics. That's the collection and discharge. Smelly discharge from the nose. For children, they may have taken in things into their nose that are not causing problem. It may even be like a polyp that has lost blood supply. It's now getting rotten. Let me use that word, and it's now bringing out a very bad discharge. You need to come to the end because sepsis can start from there, and that will be a problem. Foreign body, I've already talked about that with the children, where someone is having problem breathing on one side of the nose, nothing is entering there. Even as an adult, you feel that one side of the nose something is not going in well. You need to come to the A&E for proper assessment. To the next slide, please. Oh, mouth. So some people, because of the problem with getting to dentists, you may start finding a problem. I mean, you may start harboring your dental abscess. You say, oh, let me see the GP in 3 weeks' time. This is face. An infection anywhere around the face can quickly spread to the brain. It can spread to any parts and start spreading abscess everywhere. So there's something called Ludwig angina, where the infection from the dental abscess has spread up to the base of the tongue and spreading down all through this place to these places of the neck. And this place is getting swollen under your mouth, everywhere, your throat, everywhere is swollen. You need to quickly get to the A&E because they need to do scan for you and identify where these collections are and start you on antibiotics and refer you straight to the maxillofacial surgeons that would do the drainage for you. That's Ludwig angina. It's a very painful collection. Bleeding gum. Sometimes when people do tooth extraction, they go home and there's no room to see the dentist the next day. They're just bleeding. It's not stopping. You need to come to the A&E. Don't stay at home. Fractured or avulsed tooth, you need to also go to, if you can't get to out of our dentist, you need to get to the A&E so that they can make the arrangement for you to be seen immediately. I'll go to throat. Yes. Tonsillitis tends to be a very simple thing that occurs among children, but if your child is having tonsillitis and is not able to drink or swallow, you must take that child to the A&E because that child needs to be admitted. Even you, as an adult, if you're having tonsillar infection and you're having throat pain, you can't eat, you can't drink, you can't swallow anything, you have to be admitted because that is a problem for you. Do not stay at home. If the doctor tells you go home, tell them that I can't eat, I can't drink, I can't swallow, therefore I can't go home. You shouldn't go home for any reason. So we go to deep neck space infection. That is talking about quinsy. I already talked about one of them in the other side. So where you have tonsillar collection around your throat, now pushing all through, covering your throat. You can't breathe well. You may think it's just tonsillitis. This is an abscess that needs to be drained by the specialist. You must quickly go to the A&E. You don't have to wait. And I've talked about neck collection. Epiglottitis, there's something called epiglottis that closes the breathing pipe when you're taking in food. Sometimes it could get infected. It's it's a big problem. It can cause serious respiratory problem. Stridor, drooling of saliva. The person can't swallow, can't do anything. You need to go to the A&E. The person must be admitted. It's not go home. It's not going home. The next slide, please. So on the chest, very importantly, thank you. Asthma, COPD. You already know how people present, wheezing, shortness of breath, and all that. If you're taking your inhaler, your rescue inhaler, the one you take when you have this, and it's not working several times in a day, you must go to the A&E because, hypoxia is also one of the causes of cardiac arrest. If you can't breathe very well, that may be a problem. So you need to be attended to. They make sure that you're fine. You're having shortness of breath. MI, that's myocardial infarction, the one they call heart attack. Chest pain that is, pressing on you. It's like someone is sitting down on you. It's like someone is sitting down on you. It could be radiating to the hand. It could be radiating to the neck. You may be vomiting or feeling nauseous. That is typical presentation of heart attack. You must go to the A&E. However, there are variations in the presentation in women and elderly people. It may not come that way. If you're having a chest pain that is so strange to you, you have to go to the A&E, okay? That is how chest presentation is. For even people who are diabetic and have some chronic illnesses may not present with, that kind of typical, someone is sitting on me chest pain. It may just be, I'm not feeling very well in my chest. You have to go to the A&E. Pneumothorax, that's air leaking in the lungs. It comes with chest pain. When you breathe in, you feel that there's pain there, and then you're having hunger for breathing. Air may have been started leaking from your lung. Sometimes maybe because you had a trauma. Sometimes it just happened because you have bulle or something in your lungs. PE, pulmonary embolism. People, someone having chest pain, sometimes you breathe in, you feel the chest pain as well. You may be coughing out blood. There may be associated swelling in the calf called DVT. You may have traveled long distance by air or by car, and then you sat down for a while, then clot developed in your deep vein and then transported straight to your chest, and then that obstructs breathing and give problem with circulation. It could also cause cardiac arrest. So you don't joke with such presentation. You have to be in A&E. They have to do some tests and start you on treatment immediately. Maybe do a scan for you as well to make the full diagnosis. Dissection, yes, commoner in elderly people, but it started happening in middle-aged people as well. You have this chest pain that just started suddenly going towards your back. It's a very serious one. You can't even, it's like something is tearing your chest. You need to quickly go to A&E to present yourself. There may be associated dizziness, even drop in blood pressure, fainting. Someone just sits down and collapses. Carry the person to A&E. Even if the person recovered, don't say it's fine, it's fine. Something may have happened in the chest that has torn big vessel, and then bleeding is occurring there. To the next slide, please. Thank you. Next slide. Oh, a lot. So, all right. So we're in the abdomen. A lot of things happen in the abdomen because there are a lot of things inside the abdomen. So a lot. So upper GI bleeding, someone just starts vomiting blood, or you go to poo and then you see black coloration in your poo coming out. That's called melena. You may be having a history of peptic ulcer disease or have had this acid reflux problem a long time. You may be taking aspirin without even taking omeprazole, PPI to cover yourself. You maybe have used ibuprofen several times as an individual. That's maybe causing you bleeding in your stomach. When you're bleeding, you're losing blood, and this could cause you serious problem. You must be seen by the doctors immediately, not your GP, A&E. Acute pancreatitis, serious upper abdominal pain. You may sometimes, feel it around your back. Sometimes may come with fever as well. You may be an alcoholic, you may not be as well. So go to the A&E. Do not waste time about this. Acute cholecystitis, that's inflammation of the gallbladder. That may happen when you have history of gallstone already known. That may be the first time they also know you have gallstone. You have to, because the surgeons need to admit you, to rehydrate you, to make sure you get fine before they discharge you. Acute hepatitis, inflammation of the liver, you must also go because this is pain at the upper part of your abdomen is a serious problem as well. Acute appendicitis, commoner in younger people. I've seen it happen in 70-year-old people too, even older people, but it's commoner in younger people. That lower abdominal pain that may have started around the umbilical area and then now moves straight to the right lower side of your abdomen. It stayed there, very, very painful. You can't even stop it. Sometimes vomiting, fever, diarrhea, even constipation may be associated. You have to go to the A&E because you know what happens if appendix ruptures. I'm rounding up now. All right, so let me look for what dissection could happen in the stomach, perforation, abdominal pain. In fact, generally, when you have any abdominal pain, do not, except you know to have one form of chronic IBS or issues like that. If you have diverticulosis history and you're having this left-sided lower abdominal pain that is not stopping, you have to go to the A&E because that may be acute diverticulitis. You need to be admitted and treated. Otherwise, you may have a ruptured viscous or intestine eventually. Worse in elderly people. Obstruction will be, you cannot move. The abdomen is now getting bloated. You can't even pull. You have to go to the A&E because that's a very, very big problem. Next slide. We're rounding up and rounding up. Women in pelvic, ovarian torsion, that lower abdominal pain, pelvic pain that is so strong, it could be on the right or left. It's not stopping. You're taking anything. It has to be treated immediately because torsion may make a woman lose the ovary. Acute PID, infection in the women that is now coming with fever, abdominal pain, on their private part, there's discharge. That has to be taken care of immediately. PV bleeding could be because of, many things. Ectopic pregnancy, you've not seen your period, now you're not having abdominal pain, low abdominal pain, PV bleeding. You need to urgently go to the emergency department because they need to take care of that. Testicular torsion in male is a serious problem if not taken care of. That's pain around the scrotal area, sudden one, swelling. You must go to the A&E because they have to remove the torsion, otherwise the testicle is lost. Go to the next slide. Yes, acute limb ischemia. Acute limb ischemia, now you're having very sudden onset of pain in either from your thigh or a leg, any part of it, very strong one. You're seeing change in coloration of your leg, even make you feel numb, you're losing sensation. It means you've lost blood supply to that part of the body and must go to the A&E immediately. DVT is deep venous thrombosis, where there is blockage in the vein on the calf area and swollen and very tender. Your calf is swollen, very tender. You may have traveled long distance, driven long distance, and that has to be in A&E to be treated. Go to the next slide. Let's leave the ulcers here. We're concluding now that we've got into the leg. To the next slide. That's the finishing slides, yeah? Oh, skin, yeah. Yeah, skin. So cellulitis, you need to be treated immediately. This redness patches on your skin, and you may be having fever. It could be any part of the skin. I've seen it spread so fast. Today, it just started today. Now it's going everywhere. It can go with sepsis. So you must go to the A&E. You don't have to wait for your doctor to give you antibiotics so that it could be treated immediately. Anaphylactic rashes on your skin, sudden onset of rash everywhere. That could also be associated with respiratory problem because you've taken something you usually don't take that you don't know that you're allergic to. You have to go to the A&E. Go to the next slide. We'll finish this presentation. Yeah. Thank you so much. I'm really sorry. I took more than my time.